we are so glad and so grateful that today we have an alternative way to help people, okay, to do it, okay, to prevent, and to improve the situation in a less painful way, in a way that has got less side effect. So, which is, okay, we have our amazing Kangen water, okay, and we have so many research and journals that has proven that the ionized water, which is Kangen water, okay, has so much, okay, good review in the journals and research that they have done, okay, at the Google Scholar. So this is very, very scientific. This is not just hearsay. Yeah. So of course tonight we would like to prove that the research really work with the people who will stand forward, who come forward to share with you. Yeah. So very quickly, I would like to just give a brief overview. What is diabetic all about? Because a lot of people, what we are exposed to, okay, I would like to give you all just a very brief introduction and information on what it is. So allow me to share my slides, very quickly, for just 5 minutes. Yeah, at least we have got a brief overview of it. Yeah. Okay. Okay, this is my slides. Okay, this is tonight, okay, what we're going to share. Yeah. So now look, this is according to World Health Organization. You see how big is the population of people who have diabetes and is ever growing. Yeah. 3.7 million people, okay, actually died due to diabetes. Yeah, every year. And 422 million adults have diabetes globally. That is one person in every 11. So this is a serious numbers, yeah. That is where you can see, yeah, for global. But how about Malaysia? Okay, how about Malaysia? Are you curious to know if global, this is the number, Malaysia is better or worse? Nicholas, what do you think? What's Malaysia's number?
Malaysia.
Mm.
Malaysia, I don't know.
Okay, so how about on the floor? Okay, many people on the floor say worse. Malaysia is worse. Okay, yeah. Okay, bingo. You're right. Okay, you're right. So what is the number? Later I will show you. Okay, so in diabetic contact, right? Diabetes contact, there are two types: type 1 and type 2 diabetes. Okay, so most of us we are exposed to is the type 2 diabetes, whereby it developed over time because due to lifestyle, due to over abuse of alcohol, sugary products, and all that. Yeah. Of course, overweight, that kind of thing. But type 1 diabetes, okay, to a lot of people, they are not so aware of this. Okay, so type 1 and type 2, what's the difference? Type 1 is that your body, right, since day one, you can't produce any insulin. Okay, that could due to viral infection, that could due to genetically, your gene is like that. So once you are born, okay, you already naturally your body can't produce it. So there's a defect in your body. Yeah. But type 2 diabetes is that your body have not produced enough insulin, or your body can't use it well. Yeah. And of course now, and the third type is that pregnant woman, temporary condition that you have diabetes. Yeah. But look at that. What we are actually most afraid of is the consequence, where diabetes can lead to a lot of complications: stroke, blindness, as commonly that we know. Yeah. So heart attack, kidney failure, and of course amputation, which is loss of your legs. If you got injured, your wound can't heal. Slowly, you just you have to amputate it. So this is Malaysia numbers.
Wow, oh my goodness.
1 daripada 5 orang, okay, dewasa di Malaysia menghidap diabetes. This is scary. And we are ever growing faster. 2011, 11.2% has grown to 13.4 and has grown to 18.3. This is scary, meaning that it's almost reaching about 20% of the population in Malaysia that has got diabetes. And you see the numbers above. There are still a lot of people are not diagnosed. They tidak tahu they already had diabetes. So the numbers could be higher for Malaysians. So what do we see over here? What I see from here is that, yes, of course, gestational diabetes. Yeah, thanks, Belinda. Gestational diabetes, meaning that when you're pregnant, you have diabetic, and if you do not manage well after you gave birth, you will have a permanent diabetic situation. Yeah. So now, so over here, we can see that what I can see from my perspective is that there are a lot of people that need to drink Kangen water. There's ample of potential, for us to, to grow this and to help people, because business is about how to help people to overcome their problem. And we're talking about this is because Kangen water is prevention. Okay, it's always better to prevent than to cure. Yeah. So type 1 and type 2, the difference. Okay, here it is. Okay, if you talk about type 1 and type 2 and left and right, on the left is type 1. Usually is juvenile, childhood diabetes, that they already have that since young. Yeah. So 5 to 10% of cases are type 1. Okay. So 1 in every 200 children will have that. Yeah. But then that is in Canada. But in Malaysia, okay, I have actually checked the numbers is actually more or less is about that. So 5 to 10%, it doesn't actually run too much. Yeah. Because it's genetical. So it falls into this category. But type 2 is a non-insulin dependent kind of diabetes. So meaning that, it's an onset lifestyle that developed that. Okay, so that actually contributes to 90% of the case. And, and look, this is the age of diagnosis. So type 2, okay, is always about lifestyle, as we said. So either we have got too little or too ineffective, okay, insulin, or the use of blood glucose. Yeah. So on the left, type 1, they can't produce at all. Okay. So what are the treatments? Yeah, this is something that is so interesting. I think it's easy for people to understand. Yeah, for type 1, if it's young children who have got this problem, then they got to go for healthy eating. Of course, I believe this one applies to type 1 and type 2. Increased physical activity and regular blood glucose check. And of course, type 1, not do I know that in fact there is no oral medication that actually will be needed, but only insulin injection, because oral medication seriously can't help because they totally do not have any insulin. They can't produce at all. So, but type 2, some people may not need insulin injections at the beginning stage. Yeah. Okay, so I hope this information is helpful for you all to understand diabetes, because I believe, we have come across people who have diabetes, but little that we know that actually, these are the facts. Yeah. Okay, so great. So I have, given you all a brief overview, okay, onto that, especially on type 1 diabetes, but unfortunately tonight, we do not actually have any guests that belongs to type 1 diabetes that will come forward to share with us, Nicholas. Yeah, we do not have that. So okay. Right. So Nicholas, I shall pass to you. I think the first one to share is Jackson.
Oh, thank you, Yvonne, for your informative information. All of these are not a crack story or made up story. It's all fact and figure. You can Google it, and it's fact, and it is killing. Thank you, Yvonne, again for the wonderful information. All right, so just a little bit announcement. If you have some good testimony, good sharing, good personal experience that you have been recovered tremendously, please feel free to text our Sifu Chin directly, and he will talk to you, because we need more of you to come out and share. Yeah, All right, so we will invite the first person who share with us, none other than our famous Ewok, this called In-War King. He uses, this guy, he's a businessman and he uses Kangen water to incorporate it with his bird nest production. And, as a result, tastes amazing. And his bird nest also have very high antioxidants. So without further ado, some other co-hosts, can you help see who is talking behind the no? We can zoom in. Okay, let's welcome our Mr. Jackson Lu. All right, give him a
Hi,
zoom clap.
hi,
It's called zoom
everybody.
clap
Good
or zoom clap.
evening.
All right.
Yeah, I love
Um,
to see 140 people up here tonight. Diabetes
all
story
right.
must be interested. Okay, this is not my story. It's from one of my upline. Apparently, he cannot come tonight, and he told me this story before few times. I would like to share this story and must share the story about Kangen water, how to help a diabetes patient and how much it
All right.
helped this patient. Right? Okay, the story start like that. But 5 years ago, upline of mine is Chia Hua Ping. He's from Kuala Selangor. Okay. He got another downline in Kuantan. He went to Kuantan, he do other things. Then this one of the downline asked him to go and visit the uncle. He said the uncle got a very big problem with the diabetes problem. The leg need to be amputation anytime. The doctor advice must go to hospital to do operation, this and that. And they have no idea what to do. So he asked my upline here, why not you go and pursue him and go and
To share with him.
share with him. See, hopefully he listen, and
Yeah.
hopefully there's a hope. Somehow, then my upline follow him to the house. There's a two couple at home, old couple, and they are very moody. They don't like to talk at all because they know they're hopeless. They're going to hospital very soon. The whole kampong know, in fact, not only himself, you see. So everyone know the story already. So when this upline start telling about water, they say, don't bullshit, water, how to help me?
Yeah.
Doctor say my leg had to be cut, this is a story. Now you come and tell me that water can help me. So somehow very difficult to get into, Last my upline also tell him, since you already in this situation, why not you give yourself about a try? You just drink this water. And you may save your both leg. If not, cut down your diabetes.
All right. Technical issue, internet issues. No worry.
Oh, okay.
All right. I know nowadays at this hour, a lot of people using internet.
Okay. Can you hear me now?
Yeah, he's back.
Okay,
Jackson.
come back. Yes.
Can you hear me? Very fast
Yeah,
come
we can
back.
hear you. Yes.
Okay, so somehow he started to pursue him, to convincing him. Last he listened. Okay, install. And straight away my partner and my upline take out the machine SD501 installed for him. And he paid cash straight away. Actually, he's not much confident also, this couple. But somehow my upline keep telling them you have to, confident with this water. And he give a formula how to drink. And even to tell morning drink how much of water, afternoon drink how much of water, ml, how many ml. So make sure they're not confusing at all. Otherwise, keep on telling him you must drink 3 liter, 4 liter, they're very confusing. All people, they don't like to drink a lot of water.
Correct.
So just tell them morning you drink how much, then you drink how much, they feel easy. Oh, then every time only 300 ml, 200 ml, slowly going this and that. Somehow, so my partner had to come back from Kuantan. A month later, during the whole month, my partner been follow up with the wife. Every day call the wife, or every 2 days call the wife. Is your husband drinking water? How is doing? How is feel? This and that. Give a lot of care to her. So at least they will drink because you call them. You see.
Yeah.
1 month later, they actually call my partner themselves. Doctor say, I don't need to do operation.
Don't need to amputate the leg.
Yeah, my diabetes dropped from close to about 30, go to about 15 to 13 only now.
Wow,
So
that's
they are so
amazing.
happy. They're so happy. You see, they're so happy. So my partner, okay, you keep going, keep drinking. Then after 1 month, my partner asked me to drink 11.5. Start 11.5. Yes, because 5-6 years ago, not many people advise or tell patient to drink 11.5 because the company policy this and that. Every
Yes,
worry,
correct.
anything happen, you say responsibility. You see. So 1 month later only he asked him to drink 11.5. Also, how some my partner back there about 3 months later, this old couple actually waiting at the main gate there, very much welcome him and keep
Wow.
telling thank you. You know, he said you saved my birthday lah. At least you know, you saved my birthday. So I
Wow.
checked with my upline how he is today. He said now they're still very healthy. They still need to take some medication, but their leg no problem. No problem. Earlier they used a 2.5 to clear the posture and the swollen all sort of thing, all clear. Now no need already. Now only drinking
Wow.
water only. Drink water only. So this is a
Amazing.
story from him. I hope what you said it really give you a touch because these people been helped by Kangen water to save the both leg. Yeah. Thank you. That's my sharing. Yeah.
Thank you.
Okay.
And thank
Yes.
you,
Thank you.
Jackson. Amazing.
Thank you
So,
so much.
just
Wonderful.
a short disclaimer, yeah. So maybe new one or some other people, in the room chat, wow, 11.5. Isn't the company not allowed to drink 11.5? Yes, company policy, we don't drink the 11.5. It's for wash the vegetable. But we've somehow learned from AACI, American Anti-Cancer. They have done a research that 11.5 apparently very high in antioxidant. So why these people need 11.5? Because their body is so acidic and they need high antioxidant so that the body will recover itself. I mean, our body is amazing. But because Kangen water is a medical device, not just a normal ionizer, it doesn't work, okay? It's only medical grade ionizer. It will help the 2.5 able to kill the germs and the bacteria and outside. And because he drinks a lot of Kangen water, yes, I repeat, Kangen water really help to reverse the sickness. Imagine he has helped a person that both legs supposed to be amputated. Imagine if your uncle today, your father today, your friends today, they have no leg. You know how difficult they are. But today, this uncle has both of his legs. What is 14,000? It's priceless, my friend. It's priceless. Wow.
That's right. That's right. How much is the value of your freedom moving about, not only the legs, but it's the freedom that you can go anywhere, traveling, holiday, physical activities. Seriously, yes. And what we always, isn't it common, right, Jackson? And even Nicholas, I think a lot of us, right, when we tell people, okay, this water can help, and they say water, isn't it? Water is just water. Yeah. So this is how amazing it is, to have, to be able to get to drink this water is a blessing. It's a blessing, totally. Yeah. So okay. Now, why, Jackson? Can I just ask some questions? Now, he has problem with the wounds in the legs, right? Besides drinking water, does he use 2.5 to?
Yeah. Use 2.5 clean every day.
Sorry, one. Yeah, it's good. We can just pin it up.
Yeah, use 2.5 every day to clean. Start from the day one after you install the machine. The next day itself, then it take him about a few months. Then after that, all gone. After
There is a little bit details. A little bit detail. What do you mean by wash? I mean, how long? Yeah.
No, he clean with the 2.5 and spray oftenly lah.
Clean with 2.5 and spray 2.5 as well.
Yes. No beauty water, nothing.
With 11.5 beauty water, nothing about that.
Nothing. 11.5 come after 1 month only. Start drinking 300 ml a day.
But not for external use, yeah. The 11.5.
No, external use. That time don't know how to teach him yet, so the swollen also go off. Yeah.
Okay, so just only 2.5 works so wonderful already. Amazing.
Does the wound like very bad? A lot of parts coming out.
Very bad, very watery like that. Yeah.
Wow.
Because about the two operation already, you can imagine how bad.
Okay.
Both leg, both legs from the angle there. The doctor they tell from the angle, but it won't just not picture show there. From the knee there, from the knee.
From the knee down, yes. I've seen some leg very bad. Or 2.5, basically it's very high effective, very effective destroying bacteria and germs. That's why they
Yeah.
have skin cover back. Wow, amazing, amazing.
Yes, amazing. And someone actually asked, Aloysius over here asked, how much 11.5 did you advise them to drink per day?
Those days, my upline tell me story is 300 ml a day.
Just 300 ml a day.
Yes,
Morning.
yes. From after 1 month, First beginning drink only 8.5 start, then go to 9.5 maximum. After 1 month, then only start with 11.5. But he drink about 3 to 4 liters a day, definitely.
Yes.
I think that is the key, right, Nicholas?
Yes.
Is
Drink enough
to
water.
drink enough water.
Enough.
Yes.
What is enough? I mean, drink 3 cups not enough, man.
Not enough to detox.
Oh, all right, okay.
But Nicholas, I have one story to share with you later on. Another guest will come forward, and that is going to blow your mind. When we talk about us, normal people, that we can drink 3 to 4 liters, right? That guest, when she come forward to share about her mother's testimony, it's going to blow your mind. But of course, it takes longer time, but then it's still, got the recovery.
Yeah,
Wonderful, Jackson. Thank you for your sharing also.
Okay, thank you.
Give Jackson a round of applause. Thank you.
Bye.
You can
Good night.
clap like that. You can clap
Thank
like
you,
that.
thank you,
whatever
thank you,
want.
everyone.
Thank you. Thank you.
Thank you.
Amazing story.
Yeah.
So for those who probably have some doubt, hold on. Stay tuned. I hope the next few testimony can really elevate your confidence. So